All right guys, Dr. Kosterman here talking with you about the difference between a disc bulge and a disc herniation. So you've heard all these terms: slip disc, I threw my back out, I blew my disc out, all these different things. Essentially they just mean the same thing, right? So this is normal. So when you look at this is called a motor unit, which is basically two vertebrae. These are the bones in your back, spine, could be your neck, could be your mid back. This happens to be the lower back. There's two vertebrae. There's discs in between the bones, and that creates a space for this yellow thing. That's a nerve. That nerve is connected to this thing back here. That's your spinal cord. That's the tail of your brain, right? So you don't want to pinch that thing. So this is normal. So if anything from this disc pushes out into this canal, it's going to hit that nerve or irritate that nerve or eventually cause some trouble. But that's a disc bulge or herniation. Basically, it's pushing out into that canal. It shouldn't be. There's only so much room in that window. So when you have a disc bulge, it's where the interior part of this disc, which is called the nucleus pulposus, here's normal. It should just sit in there like that. Kind of looks like a kidney bean. So when it gets injured, it'll start to bulge. And when that nucleus, which is kind of like a toothpaste, they say, pushes out on that fiber, on that annulus, so the outer part of that disc, these rings are called the annulus, nucleus annulus. By the way, it's very, very rigid. When it pushes up against that annulus, it'll push out, and that's called a disc bulge, right? It's broad-based, right? So it's not like a point or a pencil tip, they'll often say, or a protrusion. It's a bulge, so it's pushing out. That can hurt itself. The disc can be a source of pain itself. It doesn't even have to hit a nerve. When it hits a nerve, that's when you can feel it travel down arms, legs, shoulder, all that stuff there. This is called a disc herniation, and you can see the difference, right? So that nucleus is pushed all the way through those annular fibers, which are very rigid, never supposed to break or tear, pushes all the way out, and it herniates. It squirts out into the spinal canal. Now, there's only so much room in that canal. That nerve doesn't have a whole lot of room in the hole, and now the disc is occupying that space. So how do you think this individual feels? It hurts. Right? You can't hardly move. There's only so much room back there. So coughing, sneezing, laughing, bending, twisting, getting out of bed, doing anything when you have a disc herniation can be potentially painful. So the difference is herniation is typically a little bit worse, right? So it's pushing out onto that nerve. Although both can be equally as painful, the herniation typically sends the pain if it's in the low back down the leg, sometimes to the foot if there's enough pressure. Sometimes if it's in the neck, it'll send it all the way down to the arm, fingers, depending on where it's putting pressure. So it'll squish out like this. This is an even cooler way to express what we're talking about, but it'll push out on that nerve. And you can see that's pretty dramatic and that's pretty painful, putting pressure on that nerve, right? So the difference between those two is one is a little bit more severe. You can have a protrusion, that's another name for it, where it's just more pointy. The herniation is more pointy, or you can have an extrusion where that piece of disc material pushes out and kind of breaks off and kind of goes down the canal or up the canal. That's not good. In the office, how do we address it? So, in order for me to show you this, you can see, because when you have a herniation, it's usually one side or the other, even though, or it can come straight back and hit both nerves, which means it's hitting the spinal cord. You'll feel it down both legs if it's bad enough. Usually it goes to one side. So notice I'm having to put compression on this, and it's angled. It usually favors one way, and usually, one person favors one way or the other whenever they have this happening. So there's two problems. There's an alignment issue. It's stuck in the wrong position, out of alignment, and there's a compression issue. So we address both of those in the office by gently aligning your spine, and then we do what's called spinal decompression to decompress the area, pull the disc material back in there so it can heal properly. Now, this is not an overnight type process. A disc injury is a significant injury. Some people compare it to a broken arm. I think it's worse. Right? A broken arm heals in 6 to 12 weeks depending on how old you are and how healthy you are. But a disc takes time to heal. The pain goes away pretty quickly, but we're talking about getting the pressure off the nerve, allowing the nerve to heal, allowing the disc to heal and become strong again takes time. We have a tremendous protocol in the office that's really good at it, and I think we get incredible results. So if you have any other questions, give us a call, or anybody who has a disc injury, give us a call. We'd be happy to help. We'd be honored. It's why to get up in the morning. So I think we're really good at it, and you can ask our patients. I think we have some raving fans. But at any rate, thanks for watching the video. If you have any questions, let me know. I look forward to seeing you on the next one. Bye.